My name is Renee Chenault-Fattah, and I am so excited to be back on Word, especially to be here today for this very special Founders Day as we honor the life and legacy of Dr. Walter Lomax. Now, yes, absolutely. Now, you know, if before today you had asked me what Dr. Lomax's greatest contribution is, I would have said economic empowerment and protecting our health in our communities. But after listening in this morning to the conversation and hearing the Lomax family, I know that Dr. Lomax's greatest accomplishment and achievement is his family, his children, his wife and life partner, Beverly Lomax. Let's hear it for the Lomax family as well. In fact, yesterday I was talking to one of his children, Sarah Lomax Reese, who of course is the CEO of Word. And Sarah was telling me that a while ago, she had interviewed her dad for her health magazine, and she had asked him, this was a number of years ago, asked him what he saw as the greatest impediment in our communities around health, and without missing a beat, he said it's poverty. And those prescient comments made back then are just as applicable today, which is why I am again so happy to be here and to be talking about this conversation around economics, around health, around race and place. And when we're talking about place, we're talking about, of course, where we live, where we work, where we play, where we pray, where we feed our children, where we educate our children, our communities, and how what's happening in our communities has an impact on our health. Now, my greatest fear in doing this is that when I look at the amazing panel that Sarah and her team have put together, I don't know how we're going to cover all of this in an hour and let everybody get into the sort of conversation that we need to have. So, you know, certainly any of these four individuals who are here with me could do the whole hour on their own. So having said that, I'm going to get out my readers, because when I started in the business, I didn't need them, but I need them now. I'm going to give a brief introduction to the panelists who are with us, and then we're going to jump right into this very important conversation today. Starting off with Dr. Edith Mitchell, clinical professor, director of Center to Eliminate Cancer Disparities at Thomas Jefferson University Hospital. And then Brother Tommy Joshua Cason, executive director, North Philly Peace Park. Brother Tommy is an African-American educator, social entrepreneur, and land-based community developer. Dr. Sharelle Barber, who holds a Doctor of Science degree in social epidemiology. She's the assistant research professor of epidemiology and biostatistics at Drexel University. And next to me, Michael O'Brien, Director of Youth and Adult Initiatives, Village of the Arts and Humanities, widely recognized as an expert practitioner and thought leader in community development and social change. Let's hear it for our panelists. And jumping right into the conversation, because what we're talking about is that correlation you hear about between what's more important, your zip code or your genetic code. Turns out the literature is saying it's your zip code. The conversation around social determinants of health, what that means and how that impacts us. So I'd actually like to ask the first question to Dr. Barber, because as an epidemiologist, which means you study populations and health, talk to us a little bit about, first, what this term is, social determinants of health, and what it means for us, why this is such an important conversation.
Right. Well, I first want to just honor the family and honor Dr. Lomax for his incredible contributions to the Philadelphia community. I'm a transplant, and so I've learned about his legacy and just so excited to be here. But when we talk about health, the narrative has been what individuals do. Right? Do they eat well? Do they engage in physical activity? What are the things that individuals can do to improve their health? But in epidemiology, and social epidemiology very specifically, we try to point folks into the larger social and structural determinants of health. Those are things like income. Those are things like education. Those are things like the neighborhoods in which we live, which are patterned by both socioeconomic status as well as race, and really come about because of the long legacy and the long history of institutional racism that we've experienced here in this country. So African Americans and other marginalized racial groups are disproportionately impacted by these social and structural determinants of health that we know have a direct impact on a wide range of health outcomes. So it's life expectancy, but I've done studies where we see differences between neighborhoods for stroke, hypertension, diabetes, homicides, all the kind of leading causes of death. They're higher in certain neighborhoods, more economically and racially segregated neighborhoods, again, and these are the kinds of factors that we need to be thinking about in terms of the impact on population health. Blacks have, higher rates of just about every disease imaginable, but it's not by accident, and it's not genetic. It is these social and structural determinants of health that we've experienced for centuries, really, and decades, really, that really impact our health. And so it's these broader things that we don't talk about within the context of the medical system, but definitely within public health, we, are attuned to these kind of broader issues.
Okay, and Dr. Barber, I want to follow up in a moment on, because I think it's one thing to know that there are these disparities. It's quite another, it's like, okay, we know this, now what do we do about it? So I want to go back to you on that, but I want to jump to the very end and ask a question of Brother Tommy, because you actually are a personal hero of mine, because you sort of got the connection between the earth and between growing our food and protecting our community, and it's our community, and focusing on education within our community. So I want you to talk a little bit about what your experience has been with Philadelphia Peace Park.
Wow, thank you, and high respect to the Lomax family, and thank you for putting together this wonderful discussion. We need to return to the land. We need to return to the land, and the land that we need to return to is the land right in our community. I always tell people that you can make the most easiest, most powerful revolution, which is a big change. Only thing you have to do is go outside and clean up. Go outside and get to the land. Go outside and build beds, grow food, gather the children around, start education. When we go back to the land, we will see our health get better. We will see more respect other people will have for us. And we will also see the possibility for generational wealth. So North Philly Peace Park is a movement for local democracy. And is a movement that we are very conscious that we didn't invent. We understand that we have the ancestors with us. We understand that we have our culture with us. And most importantly, we understand that we got people of goodwill with us. So I would say land-based lifestyle, land-based culture is what we need to get right back to right in our communities.
Brother Tommy, thank you for that. And it's interesting you would say that, because this morning when I was listening, and one of the Lomax children was saying that Dr. Lomax talked about there are miners and there are farmers. And the miners are the ones that take, and the farmers are the ones that give. You're one of the farmers out there. Dr. Mitchell, right now I'm working on a documentary on Alzheimer's and other dementias in communities of color. But truly, the first documentary I really ever worked on was with Dr. Mitchell, when this must be 15, 16 years ago. Dr. Mitchell did such an impactful story on Black women can beat breast cancer. And I want to talk to you about that, because it seems as if when you talk about the cancers, when you talk about breast cancer, it seems to be particularly virulent in our community. Talk about the impact of these social determinants of health when it comes to the cancers, breast cancer in particular.
So, Renee, thank you very much. And thanks to the Lomax family for inviting me to be here. And my congratulations to the family for maintaining Dr. Lomax's legacy. He was a hero of mine, and I knew him before I actually came to Philadelphia. But once I moved here, he was so kind in making sure I knew where everything was in Philadelphia, and we would meet and he would tell me all about things, and he introduced me to Philadelphia medicine. So again, thanks to the family for maintaining his legacy. So as a cancer physician and oncologist, I see a lot of things in the community related to who we are and where we've come from and what we're doing now. So for cancer medicine especially, Some of the risk of developing cancer are related to lifestyle, where we live, social determinants of health, and that certainly can affect access to care, access to the right screening, and the right protections to try and prevent cancer. However, there are some genetics about cancer that we are working on. For example, in breast cancer, what is called triple-negative breast cancer is a difficult cancer, whether it occurs in a black person or a white person or a brown person, in whomever. However, African American women have twice the rate of triple-negative breast cancer. And what that allows for is more deaths in black women. Not only that, triple-negative breast cancer occurs in younger women. So I have patients in their 20s and 30s coming in with advanced breast cancer for many reasons. Number one, everybody believes they're too young to have breast cancer in the first place. So when they tell the medical personnel that there's a lump in the breast, many times they don't even check it. They say, oh, it's not cancer, you're too young for it. So part of the medical system can fail black women because nobody, or many of the medical personnel, don't know themselves, and they blow it off. Not only that, so for triple-negative breast cancer, twice the frequency, twice the incidence rate in Caucasians in this country, which means that the cancers are more aggressive, they grow faster, they spread to the brain and the lungs and the liver and all over the body much faster, even for tiny, small tumors. And even after appropriate therapy and appropriate treatment, they return and come back faster than other cancers, and consequently, the death rate from triple-negative breast cancer is more frequently seen. But that's not the only cancer. Prostate cancer. Prostate cancer occurs more frequently in African American men, and just like triple-negative breast cancer, younger age, more aggressive tumors, so black men not only have a higher incidence of prostate cancer, but a higher death rate. And I could go on and say more about other cancers, but getting into the system so that there is access to care, we have to be advocates for ourselves.
I want to
and make sure that happens.
And I want to follow up on that, but I want to get to Michael before we circle back, because you were just starting to get into this whole issue of access and advocacy. So I want to return in just a moment on that point. But Michael, dealing with the community as you do, and I know you've done a lot of also great work with young people, what are you seeing in our communities around the impact that these social determinants, which is really just a fancy word of saying, a way of saying what makes us healthier or less healthy, but what do you see in your work?
So, thank you, and hats off to the Lomax family to having black-owned media. I think it's actually important for our health that we have spaces to have these conversations. So, you know, hats off to that. One of the main things I see, and this is actually interesting, I just came back from New Orleans. I was at a national symposium on health equity and community development for an organization called NeighborWorks America. And I was there to talk about this idea of trauma-informed community development. Trauma-informed is a big buzzword. It means a lot, so much so now that it's starting to almost mean nothing. So we got to be a little careful in that area. But the really important thing is to think about community development as human-centered. And so when I am thinking about, and actually I'll correct myself, I'm even moving towards like humanity-centered, because there's so much we don't understand about our species, there's so much we don't understand about what we need to maintain health. What do we need to achieve, a good status, if you will, of health, and then to maintain health? Because maintenance is a whole other issue. So there are two complications I'm seeing in neighborhoods. Actually, I can talk about, I think, in one paradigm. People are heavily inundated with chronic stressors. Parenting alone, managing a chronic illness, caregiving, intergenerational caregiving, caregiving for someone that has a disability of any kind, right? Like, there are so many issues that people are dealing with where money, no matter how much you have, isn't necessarily going to take care of the amount of stress that's going on. That's why we call it chronic. I've also heard the term relentless stress being used. So there are a lot of issues that people are dealing with on a regular basis that they're not even registering anymore because of the way the body works, how stressful it really is. But it still is having the same toll on their body. The other thing that people are dealing with is trauma, right? And I'll give you two quick definitions. One comes from the American Psychiatric Association, which says that trauma involves a perceived or literal threat to one's emotional or physical well-being. And that threat is going to elicit or bring out feelings of terror, helplessness, or a lack of control. I love that definition because there are qualifiers there. I can't tell you what's traumatic because it's perceived or literal. So your intention doesn't matter much. We gotta trust the intent, but own the impact of whatever is transpiring, right? And then the second definition is that a traumatic experience is whenever something that's happening to you is overwhelming any internal or external abilities or resources that you have to cope. So using those two definitions and thinking about trauma and then thinking about chronic stress, the problem with Philadelphia, where the poverty rate is high as we have it and what we now know about life expectancy, and we can go down the list of redlining on all these other issues, folks are living, if you think like a Venn diagram of two circles with an overlapping spot in the middle, here's trauma, here's chronic stress, a ton of folk are living in that shared spot in the middle, which I call exponential toxicity. We are exponentially exposing people to risk. And the reason it's toxic is because stress in the body and too long of spurts and way too long of an elevated period of your heart rate, et cetera, this is not healthy for the body. It is wear and tear, something called allostatic load. There's a lot of info out about this. We know about it in this region. I'm glad that there's a social epidemiologist on this panel, but this is the problem that people are living in and trying to maneuver regular life with. And it's very hard to try to solve problems and be cognitively present when your body is under that much duress.
So Michael, I'm just going to sort of like echo what you just said. We know this. We know the chronic stress. Dr. Mitchell, we know it seems as if you go down the list of maladies and every one of them we are disproportionately impacted by. The documentary I'm doing on Alzheimer's in communities of color, the reason we're more at risk is because the risk factors of diabetes and stroke and heart disease are more prevalent in our communities. So I'm going to throw it back to Dr. Barber. We know this, so we have this information. Right. What do we do? What policies? How do we change this? Because we know what's happening in our communities.
So a couple of things. One, I think we have to talk multi and cross-sectoral, right? So these problems are overlapping, they're different sectors, and instead of thinking about health and the cure, if you will, being contained within kind of the healthcare system, we have to think actually outside of the healthcare system, because it's when you show up to the doctor, you've already experienced all these things in your community and the neighborhood that you live in, and so we need to be thinking about these broad policies. And then I'll point to an example. Actually, the California Endowment has this Building Healthy Communities initiative. And the powerful thing about the endowment is that, yes, it recognizes these social, these structural determinants of health across the lifespan, across generations, et cetera. But what it centers in the way it does its work is building people power and building agency within communities in order to challenge the policies and the policymakers that are detrimental to the health of our communities, right? And so it centers agency, it centers power building and comes up with strategies to address different social and structural determinants of health in communities. And so it has actually, I think it's 12 communities within California, very different kinds of communities, where they've invested about, I think it was $1 billion over 10 years into these communities and said, if we give you this investment And we center community engagement and community advocacy and community and people power. What are the things that we can see in terms of changes in the social and structural determinants of health? And it's a really powerful model that I think it could be a model even for here in Philadelphia.
Let me ask you, so I understand. So it sounds like you're saying that organically these organizations, I mean, you're looking at what's in the community because there's trust, and which would be exactly what Brother Tommy is doing with North Philadelphia Peace Park. I mean, is that what you're talking about?
It's similar to that, right? It's taking the assets, because we often look at our neighborhoods as deficits, right? We often look at just the deficits in our neighborhoods. It's saying what is within our communities, how can we build capacity, but capacity to challenge the systems, because it's the systems that are creating these conditions within our neighborhoods. And knowing that because it's heart disease, it's diabetes, it's if you can tackle those upstream kind of factors, then you actually can make an impact on multiple health outcomes and really well-being for the community.
I'm so glad you said that, because we do oftentimes just focus on the deficits versus all the strengths that reside in our community, like WURD, like what Brother Tommy is doing. Would you like to follow up on that a little bit?
Yeah, I really appreciate everything that's being said. So what we're going to have to do first and foremost as a community is we are going to have to make a firm decision. As individuals and as a collective, we are going to have to make the decision that we are simply no longer going to live in a death style. We're no longer going to accept what's given to us. We're no longer going to accept the conditions of our communities. When we make that decision ourselves, that's the beginning of the change. And if you believe, because I'm a big believer, and we wouldn't have been able to accomplish anything at the Peace Park if it wasn't for the help of the Most High. If you stand up right now and the death and destruction, the graveyard that our communities have been made into, if we stand up right now and make a difference, right now the vacant land inside of your community is the battlefield for the future. I'm going to say it again. The vacant land within your communities is the battlefield for your future. That's the place where we all need to meet up at. Folks who work in the medical field, doctors, educators, farmers, engineers, architects, security folks, let's meet up inside of our community and let's start to transform our community by transforming the environment. And the last thing I want to say is that as we talk about the apartheid that we suffer here in the United States and Philadelphia, we notice that there's a reciprocal of it, because the reciprocal of our neighborhoods being graveyards, essentially, is white neighborhoods being heavens, right? So we also have to stress the role that racial segregation plays, where we are purposefully herded into communities where there's chemical pollutants in the water, chemical pollutants in the air, chemical pollutants in the food, right? So the North Philly Peace Park once again appealed to each and every one of you. Join us on the land that's inside of our community. We can build farms, we can design and build new schools, we can develop economic structures. What we always lacked as a people was being land-based. That's your human right. I encourage you all to support agricultural projects in our community, and more so, come on outside and let's transform the vibration of our neighborhoods with positivity and with love.
Brother Tommy? I want to follow up on what you said about the apartheid. I saw an article in the New York Times recently which said that even climate change affects our community differently than it does others. So I said, all right, let me look at this. I happen to be in Baltimore filming, but it could easily have been Philadelphia or Chicago or any place. Drive through our neighborhoods, and maybe there was 1 or 2 trees on the block. The row homes had the black asphalt on top, you know, drawing the heat. The point of the article was that in our communities, because there's so much asphalt, there's so much vacant spaces, there aren't the trees, we have degrees higher than when I went a mile, 5 minutes away in Roland Park, where there obviously were trees and greenery. So what you're talking about, like I said, it's Baltimore, but it could be any of our cities. Dr. Mitchell, I want to go back to what you were saying, because I had interrupted you. You had talked about whether it's breast cancer, whether it's prostate cancer, how these types of cancers affect us and why it's so important that we take an advocacy role. Could you continue with that, please?
Well, certainly. So we can go back, Renee, to Dr. Martin Luther King said, of all of the inequities caused by racism, the inequities in healthcare are the greatest. So for our communities, we get the worst healthcare. We have the lack of insurance. And people say, well, insurance doesn't make a difference. There are data now from the ACA, Obamacare, that people are living longer because of that. And just this year, we have the data showing that cancer treatment in individuals who have the ACA are better than those who did not have access to care. In the states where with the ACA, there is Medicaid extension and facilitation, those states have better results from cancer incidence rates and cancer mortality rates. So fewer people are dying because of that. So I'm an advocate of putting it all together for healthcare. Our communities, the food, the beauty, the trees. You know, plant some flowers. Plant something that grows. And with that, people are happier. So therefore, there's less what? Less stress?
Less stress.
Less trauma. So, and when you're healthy, you're happy. Nobody is happy being sick. Nobody is happy being sick and don't have a doctor to go to. Nobody is happy being sick and having no insurance and knowing that if you did get to a medical center, you didn't have the money to pay for the prescriptions or to get the care that was recommended. So it all goes together, and you can't separate these things out and say, well, this one is the cause. It's a circle. And where in communities where there are no supermarkets, no food, where there's trash on the street, no trees, you know, that's where there is increased our lack of access. And we have, look at our communities. The data just came out this year. I've talked about cancer, right? But look at our mothers. More young black women are dying having babies than anywhere in the reformed world. Here in America, black women.
And having
Young
nothing
girls.
to do with our socioeconomic level.
Dying.
I think of Serena Williams, who almost died. Is there anybody
Yes.
wealthier than, you know, across the board, whether you're talking rich
And-
or poor? It's
And you can, as you said, I could talk an hour about this. There are data showing that two people go to one of the top hospitals in the country, I won't name it, with lung cancer. Little tiny nodules in the lung that are primarily cured with surgery. White person is offered surgery, the black person is not. So there's even socioeconomic issues. But even with individuals who have money, who have insurance, they can be disenfranchised in the system. Serena Williams is, you know, the epitome of that. She almost died having a baby. So we've got to pull all of our things together. And let me just say, the one thing that we all in this room can do is get together and vote. We need to bring together our communities, support who we think will represent us when they've got to speak for us. When they've got to vote on a health care plan, get those people into office. And that's something we can all get out and do. We can do it right now. For many years, you know, we couldn't vote at all in many municipalities. And even now, we are forced out because they are reevaluating, rechanging boundaries and so forth. And we've got to fight that. We've all got to get together, grow some food, get some health care, relieve the trauma and the stress, make our neighborhoods look good, and be proud of who we are, and get out there and vote.
Absolutely. Couldn't be said better. Thank you, Dr. Mitchell. Dr. Barber, I want to go back to this idea of, you know, we have the data. I mean, and there are databases out there. You can, you know, the county roadmap where you can see where the disparities in Philadelphia County versus Bucks County or Bucks County for child poverty across the board. So how do we start to, while we vote, which is essential, we can't let happen in 2020 what happened in 2016, what can we do in terms of taking this information to affect and to inform policy?
Yeah, so one data resource that I do want to bring to your attention is something that the Urban Health Collaborative at Drexel actually just put out with the Philadelphia Health Department, which is the Philadelphia Health Rankings. So RWJF has these county health rankings, and the Urban Health Collaborative just put out neighborhood-specific rankings for Philadelphia. So you can go to, it's an interactive map. You can go and you can see life expectancy and other outcomes by the neighborhoods in Philadelphia. So I just want to put that out there. Again, I think all of these things that are being said are important. And I think starting local is important, right? So we often, which we need to think about kind of federal, state, and local policies. But the local policies, I think we don't pay attention to enough and I think that's actually where we have the largest impact and can really have the policies that impact our communities most directly, right? And so we need to think about what zoning laws look like, right, in our communities. We need to be thinking about fair and affordable housing in our communities. Are there policies that would help us to address the kind of wage gap that we see in our communities? And some of those can be at the local level. What are the policies around policing? Because we know that that's another trauma, right? Within our communities, the over-policing of our communities is a trauma that we experience. And what are we doing at the local level to address those? And so I think, you know, it's not a magic bullet, right? But it's thinking, again, cross-sectorally, multi-sectorally, and actually sometimes outside of the healthcare system, because the healthcare system will not solve the issues we have. You can think about things like grocery stores within neighborhoods, but also remembering that when we do start these investments, you can have the negative impact of gentrification in our neighborhoods, right? So how do we invest and develop neighborhoods without accelerating kind of changes that actually displace individuals?
What about land trust? Is that?
Yeah, land trust, and there are a lot of different solutions. And again, I think it takes communities coming together, communities being organized, and communities strategizing to say, because the communities know what they need, and we've been, you know, asking for this from our local representatives for years. So it's going to take that kind of strategizing to come together and say, what are the things that are going to build, you know, healthy communities for everyone, and change these inequities that we see between neighborhoods in our city.
Michael, I can see you want to weigh in on this.
Oh, yeah, there's lots of thoughts. So there's some techniques we can use, borrowing from like the design world, where, you know, if you design for some of the most extreme and intense cases, or if you design for the most vulnerable, right? And the term vulnerable gets thrown around with Black and brown folks in urban spaces a lot. To the point where I just kind of like, it makes me scratch my head, because I'm like, I don't even know what that means anymore. But in this context, we know through data that children and women are very vulnerable. And by vulnerable, I mean the underreporting of sexual abuse, harassment on the street, issues in the workplace, right? I mean, the Me Too movement is a moment of power that women and femme bodies have taken on in a beautiful way to address the true vulnerability and the lack of safety for women just walking down the street or trying to show up to work to make income. Because we've tied income to every biological necessity for a human to survive. Think about, just in terms of climate, biothermal regulation. The human body can't just sit out in the weather, not unless it's really temperate and you're kind of near the equator. And even then, if it's raining all the time, you still can't sit out in that. So we've done a doozy to ourselves with things like clean water access, et cetera, all being tied to income. So in that context, there are ways to design for those who are most vulnerable and most susceptible to this risk that we're talking about. And in designing solutions with those kind of like points in mind, you actually begin to realize that a lot of this stuff becomes universal. And you can actually start to borrow. There's a technique called modular design. You take a system and break it apart into smaller components, designed for that one part of the system, and then you are then borrowing from that part of the system to address another part of the system, and you do that again to another part of the system, and bit by bit over time, you actually start to end up with things that are now affecting huge swaths of the population or huge swaths of the organization or company. And I think we could be borrowing from that, because again, we're talking about what's good for human beings as a species. Connectivity is direly important to us as a species. If a human doesn't connect, you will not survive, particularly the younger you are. Humans are kind of like brain cells. Brain cells are fascinating. If a brain cell doesn't connect to another brain cell, it literally withers and dies. And so the same is with an infant. Human infants are born absolutely helpless. They can cry, they can poop, they can barely hold their neck up. If they're not connected to an adult or someone just a little bit older who can feed it, soothe it, take care of it, wash it, it's literally not going to survive, and it's also not going to develop skills. So I do think that there are ways, again, that we could be looking at these issues, these determinants or influencers of health, and be designing ways for the most vulnerable and then borrowing from that and applying it to whole swaths of the population.
Michael, this may be
Thank you.
a little far afield, but I want to follow up a little bit on what you're saying, because you work so much with our young people. And the things you're saying about innovation and design, we usually think of it, or we shouldn't, think of it in terms of Silicon Valley and not our kids. And I know that in working with our kids, are you implementing some of these things that you're talking about around innovation and design, using their talents and skills to come up with solutions that are going to benefit?
Absolutely. And when we talk about young people, again, these definitions are so funny. So I worked in housing in the city for years, in emergency housing. If you're 18 with a child, you're considered head of household.
Ugh. That's a child.
I mean, let's just be clear about when we use the word youth, depending on the sector or system, to HUD, a youth goes up to like age 24. Juvenile justice, that's not the case. And you want to talk about the backwardsness of our systems and why I teach young people, and I'm bringing in often people to teach young people about user experience design, modular design, blah, 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 blah. In our city, and luckily we have a DA, and this is why voting is so important. We got to keep Larry Krasner in office. I'm probably going to get beat up for saying that. I don't care. We got to keep Larry Krasner in office. That attack on him from our state legislature was so out of pocket. And here's why we got to keep Larry Krasner in office. In our city, at 18 years of age, and we teach this to young people and then have them think, how do you use design and innovation to attack these spaces? At 18 years of age, if you get caught with, I'm just going to be really loose here, drug possession, there are diversion programs for you, mandated by, or excuse me, run by the courts, but it's there. If you're 17 or under, there is no diversion program for you if you get caught with drug possession, particularly looking at things like intent to sell, intent to distribute, et cetera. The University of the Sciences has an MBA in medical cannabis.
That was the drop the mic
We have
moment.
to vote and keep Larry Krasner in office because They are trying to address this issue. We have to keep people in office who are going to think innovatively and want to partner with young people who are learning these kinds of things, because communities do know what they need. And when you teach these methods and innovation and design and human-centered solutions to young people, now you have young people doing a couple of things that directly address trauma, directly address some of these social influences of health. They're no longer necessarily feeling powerlessness. Remember the definition of trauma: powerlessness, a lack of control, terror. When you feel like you can understand an issue, when an issue begins to become demystified for you, now we are talking about you beginning to stand on some stable ground to then try to iterate forward what a solution could look like. When you learn the facts, you learn how the levers of power work. You learn where there's gray area where you can start wedging into these issues, or gaps, and you can start wedging into these issues. And we're partnering you with intergenerational folks and coalitions around this stuff. Now we're talking about sharing power. We're not empowering you, because there's still something a bit underhanded about, I'm here to empower you. No, bro, I'm here to share power with you. No, sis, I'm here to share power with you and share my platform. And so we equip with skills. We have appropriate technology and a number of art forms, number of media forms at the Village of Arts and Humanities. We teach organizing techniques and principles, and we help young people begin to better understand. And by young, I'm talking about over 18 too, because we got medical doctors up here. They'll tell you adolescence is not ending at 18. That is a farce. But I could go on and on, but I think you get my point.
Absolutely. And you know what? It's good that you go on and on, because I think it's important we see that all of these subjects are interconnected. And for too long, we've been in silos about this. And I want to go back, Dr. Mitchell, to what you were talking about.
Sure. So I think that one of the things that we can do is bring people together, not having everybody in silos where, well, they're over there doing that and they're over there doing this. Bring us all together. There is no one shoe fits all to fix all communities. But we who live in those communities know what we need, right? So we pull people together. And if an educational program after school for kids, if that's needed, we get some people working on that. If we need to fix that area over there where they shoot up drugs and it's been vacant for years, we need to grow some things, let's get some people working on that. If we need to bring a supermarket into our communities or other things, let's get with the right people so that we can bring supermarkets into our communities. We can get our city council members working with us in the communities on what we need. Because one zip code might need something different from another. But if we're all together and working together, then we can define solutions to some of these problems. So I'm a proponent of getting people together, getting people to work together, because if we're all working and moving in the same direction, we can be more powerful, we've got more people, we've got more individuals with occupational and, down south they call it mother's wit. But people who know things and can do things and can make things happen.
Brother
So
Tommy.
we've got to do that
Together.
and we've got to focus on those things we need, because we've talked about different things in terms of our careers and what we're doing, but one depends on the other. If you can't get your kids educated, they can't get into the positions that they need. So therefore, healthcare, food, all of those things suffer, and that, of course, relates back to what Dr. King said. If you don't have those things, you can't get the health care. And the health care is still the most serious of all of the inequities that African Americans and other minorities in this country suffer from.
Dr. Mitchell, you can't see Brother Tommy behind you because he is
I'm
so
agreeing.
in total agreement with you. He wants to chime in on this.
Okay, well, this has been a great panel. Thank you, WRD, and for the wonderful moderation and for the colleagues. I want to end off with you from myself, as I want to share with you a vision that I had about us and about our communities. And you can take it for what it is, but this is just what I seen. I seen a new community. I seen a new community of us living, like here and right now. The same neighborhoods that we at, the North Phillies, the West Phillies, the Uptowns, the Germantowns, the Down Bottoms, the same streets, the Germantown Aves, the 52nds, the 60th Streets, the 27th Streets, the 15th, the 22nds. I seen us, and I seen us right. I seen us healthy. I seen us safe. I seen our neighborhoods producing food, growing food, all type of food. I seen trees with all type of fruit. I seen vegetables coming out of the soil. I seen black people cooking these vegetables, eating them, making things out of them. I seen the same buildings, but these buildings was factories with computers in them, with machines in them. I seen this. I seen a vision. I seen our children, little boys and girls, happy, laughing. They ain't know nothing about white supremacy. They didn't know nothing about somebody telling them that they ain't nothing, somebody wanting to hurt them. I seen that, and I seen that right here, and it was us. It was us in power, us right here, united with each other, protected, safe. So I want to just leave that vision with you of a new community. It was us, and we was in power right here, right now, inside of our communities. It was abundance of food. It was medicine for us. The medicine came from the ground. There was people like Dr. Mitchell's that was teaching us about how to use that medicine. There was brothers and sisters like the ones right here breaking it all down for us. This is the vision that we fight to make a reality. I encourage you all to support the North Philly Peace Park, because we down 22nd and Jefferson in a neighborhood that's being gentrified. But we believe in the Most High, and we know that the plan that some may plot for our people since we've been here, a plan for genocide and a plan for slavery, we know that is a greater planner. So what I ask you all to do is believe in that greater planner, believe in that greater vision. We must take action. We must unite with each other inside of our communities. We need land. We need unity. We need peace. You deserve peace.
And Brother Tommy, you couldn't see, but Dr. Mitchell wanted to respond quickly to what you said. So
I think this is all great, and yes, I have my garden still. My mother and grandmother taught me. But one of the things we have to do is educate our kids.
Yeah.
Now, ask me about doctors in this country. African Americans make up almost 13% of the population in the United States of America. And yet, for black doctors, 3.9%. And it hasn't changed much in the last 35 years. So we need to get more people in our communities who can provide health care to us. So we got to send our kids to school. We've got to enable them and show them that they can exceed. They can become doctors and nurses and all of the other healthcare providers, pharmacists and all. But what we find is that there are fewer kids finishing high school, fewer finishing college, so that they can get into those areas. So we got to bring up our kids and give them some hope, give them some food, make sure their environment and their communities are safe so that they can feel comfortable in doing these things. And then for other individuals, we've got to teach our kids that there is hope.
there is hope.
And we've got to make that hope, and we've got to show it.
Absolutely. The few
So-
minutes we have left. Thank you, Dr. Mitchell. Dr. Barber, would you like to say a few words? And then, of course, Michael, we want you to close us out.
Yeah. No, I'm just appreciative of everyone that's been up here speaking that truth, and I just want to echo the need for vision beyond what we see, right? And also just hearken to the ancestors, right? And the folks who came before us. The 1619 project just came out with which I think is so powerful.
New York
but
Times.
In the New York Times, and what it does is it talks about the inequities and the injustices and the racism and all that, but also the resistance, right? And we are people who have actively resisted and organized. We've been scientists and doctors and lawyers and sharecroppers, and that's our legacy, that's our history. We've actively resisted and made things that were unimaginable happen, right? And we've done that in the past, we're doing it now, and we can do that into the future. And so I am so appreciative to you, Tommy, it is, right? For just showing us that vision, because I think having that vision and moving us forward and us all coming together will help us to realize the equitable communities that we all want to be able to thrive in.
Thank you, Dr. Barber, for, again, circling back to focusing not just on those deficits, but on the strengths.
Right.
And God knows we have a lot of them. Michael O'Brien, you get the last word here.
Wow, that's no pressure.
You can handle it.
No
stress.
I just want to underscore everything that was said, and Brother Tommy laid out a beautiful vision that I'm sure for many people feels so far off. But the engine for starting that actually is found in how willing we are to bear witness to each other's suffering, to bear witness to the capacity for change and each other's growth. How willing are we to listen, particularly to our young folks? And again, young for me is not just, when they're 12 and 13. I'm really putting a lot of attention right now on the 18 to 30-year-olds that we will throw away so fast because they did something that we did not like. They quote unquote broke the law. We forget that they were the 12-year-old that we think is cute, who still had very little resources and was still vulnerable. Can we build space to bear witness to the truth of their story, the truth of the suffering that they might have had to endure for quite a while? Can we not try to tell them that they're right, but just literally listen? It is fantastically amazing. We want to unlock potential in people. It is fantastically amazing what bearing witness to someone's narrative can do for them. It is minimizing when we hear that what I perceive, remember the definition of trauma, perceived or literal. Perceived or literal. If I perceive threat and danger to my emotional or physical well-being, and I try to bring that up, how diminishing and minimizing is it to hear it's not that bad? It can't possibly be that bad. It's not that serious. Or you don't know nothing about struggle yet. You are only X years old. We do that so much. I'm 34. I found myself slipping into that. I had to go, Michael O'Brien, shut up. Bro, you are minimizing the experiences and the reality of that person's emotional encoding, which has a biological encoding. We're talking about health. Emotions and physiology go hand in hand. How we make people feel has a direct impact on their body. There is no way to begin this engine for Tommy's vision, for our collective wellness, without being able to step back from being right and just being able to step in sharing humanity with another person. I'll end it with this. If community only begins and ends with people who look like me and people that I can see, we're done. Somehow we have got to stretch it to the people we cannot see. And for black people, classism is going to be the ruin of us if we're not careful, because everybody in this region is talking about diversity. So they'll bring a bunch of black folk in a room together. But it is fascinating to me in being in some of those rooms. The conversation around class does not happen, and the minimizing of people's experiences connected to their income and their educational outcomes. It's fascinating how minimizing that all gets. So, done. Okay. Love each other.
Thank you, Michael. I want to thank our panel. I want to thank everyone for being here today at the Free Library.